Good morning everybody, and welcome to this instruction course on low vision. So we bring to you this course from Jodhpur in Rajasthan, and me and my colleagues are going to talk to you about clinical low vision. So low vision, as you know, is very poorly developed in our country, and that's the reason why this instruction course is being presented to, I must say, a very small audience, but that's all right. And the twin goals of this course is to understand the concept of low vision and its treatment, and to develop the necessary clinical skills to identify and treat low vision cases in your day-to-day practice. So now when a person has got low vision, then there are profound implications on the social and economic life of that patient. See, the daily living skills go down, then the social interactions of the patients go down, and most of these patients are elderly, so they're susceptible to falls and injuring themselves. And that's why it's mandatory that we as ophthalmologists do something to rehabilitate them. And rehabilitation of low vision patients consists of actually functional evaluation, clinical examination, optical and non-optical aid evaluation, patient education and instruction, and proper follow-up and post-follow-up care. Now the goals of low vision management, whatever you do, whatever machinations you do, whatever treatments you give, is to maximize the visual potential of the patient. And you can do it in many ways by giving them optical and non-optical aids and electronic aids. And we'll discuss all about them in the next sections. So low vision care or low vision rehabilitation is actually a team effort. So you have the ophthalmologist on one hand who's doing the clinical evaluation and considers what types of low vision are most appropriate for the patient based on the diagnosis, the ophthalmological diagnosis, and prognosis and future medical and surgical interventions for that particular patient. He is helped by the optometrist who does the low vision assessment, retinoscopy, refractive correction, and then final dispensing of the low vision aids. And some people who got profound visual loss or multiple handicaps, then a rehabilitation specialist comes into play who does the functional vision assessment, the psychological counseling, career guidance, and orientation and mobility training. But most of us are in private individual practices, solo practices, and we don't have access to rehabilitationists or even optometrists sometimes. So we are going to talk to you about how an individual practitioner can develop low vision treatment in their clinics. So a couple of years ago, the Supreme Court also had a ruling that one has to admit low vision patients in MBBS courses. In previous years, blind people and low vision students were not allowed into MBBS courses, but now there'll be more and more low vision students coming into MBBS, so we should be very aware about the problems of low vision and how to treat them, because our own colleagues will have low vision sooner or later when they join MBBS courses. So this course is divided into 8 parts actually. This is a misprint over here. So we'll begin by definition of low vision and epidemiology, and then go on to discussing the principles of treatment and then types of LVA devices, then discuss about light, glare and contrast management, then actual prescription of low vision devices, and then consider what's new in the field of low